Um, real quick before we jump in, I'm also proud to be partnered here with my colleague Herbert Bolaños from Woodcraft Rangers. I'll let him sort of introduce himself right now, and then we'll get into our session.
Everyone, my name is Herbert Bolaños. I work at Woodcraft Rangers with Andres. I am the education specialist at Woodcraft Rangers, kind of helping with curriculum support and also with training support. I'm glad to be here. Thank you for having us, and I'm excited to kind of share what me and Andres are sharing with you all.
Awesome, thank you. Yeah, Herbert's going to walk us through something a little bit later. But as was mentioned, my name is Andres, or go by Dre. I'm the director of learning here at Woodcraft Rangers. And for those of you who aren't familiar, Woodcraft Rangers is a nonprofit after-school program based out of Los Angeles. We're almost a century old, founded in 1922, with a real emphasis on whole child development. And to us, that means sort of supporting our young people in the development of their minds, bodies, spirit, and commitment to service. And so as a part of that, as a part of the focus on the body, we certainly want to make sure that health and nutrition and general wellness is a part of that. And so we were excited to be able to be welcomed and invited into the conversation today, and look forward to sort of sharing some information and some techniques that we have, but also I'm really excited to be able to learn from everyone here on the call as well. I think as has been exhibited by our, the first two presenters, this is a situation of many hands making light work. We really need everyone's efforts across the country to contribute to, the health and safety of all of our families everywhere. So our hope for today is to, I think, sort of piggyback on some of the conversations. I think it's certainly, appropriate that we're going last based off of the conversations. But we really want to hone in on sort of a particular challenge that we know, many marginalized communities are facing now as it comes to health and nutrition, and talk about sort of how we are approaching some of those challenges. And then we want to give you an example of one of the ways that we at Woodcraft Rangers have really sought to impact that challenge. And so, to start off, we really want to frame that, in our work currently, what we have seen, or what we have identified as some of the major challenges right now to health and nutrition have been, first, just access to healthy food. Right. I think Clarissa brought that up as a great point at the beginning, right? Just knowing and being available to how our families can have access to food that we know is important to sustaining health is a challenge for many of us. And so programs like FRAC and programs like what South Carolina just provided are a way for us to really be able to focus on that. Additionally, we know that an important aspect of health and nutrition is access to support. Right? How are people a part of a community that is really helping us stay connected and motivated to being healthy? Right? And I think that the resources that Daniel shared, I think, are a great part of that. And all of what probably everyone on this call is trying to do, right? Our programs and our individual efforts are all centered around helping provide and boost up that support that our communities are feeling right now. And so that they not only have access to the food, but they also have access to the feelings of wanting to stay motivated and wanting to stay healthy. And we know that that is incredibly helpful. But what we want to focus on today, in at least our portion with Herbert and myself, is the idea of truly access to this information. Right? That we know sort of the third part of this is awareness of and the ability to actually see and attain the information such as what we just talked about on this call. Right? The existence of this information is amazing, but that existence means nothing if it's not actually in the hands of our families. And so we really want to talk about sort of how to create an equitable system of communication, right? And how we as organizations can seek to ensure that all of our families have the access that they need to the information that we know is important to promoting and stimulating their health and wellness. And so what led us down this pathway, right, is that, like I'm sure all of you on this call have experienced, we at Woodcraft Rangers realized that our main mode of communication was direct to consumer, right? What we relied on so much was speaking directly to our families, right? Our after school program, being able to see them every day, being able to provide them with information in person. And that all of the rest of our systems of communication, our social media, our webpage, right? Our even phone and email, all of those were secondary, were supplemental to the knowledge, right? That our primary system of communication was that we had access to our people every day. And so when we removed that from the system, when we removed that from our environment, all right, our ability to actually speak to our individuals on a day-to-day basis, what we found is that all of those supplemental systems were not built sustainably enough or effectively enough for us to be able to communicate in the way that we needed to. Right, that we no longer had the access and the reach to be able to talk to our parents and talk to our young people as efficiently and as effectively as we needed to. And they all lived within this ecosystem of being reliant upon day-to-day communication with families. And so that's forced us to realize that we needed to change the way we communicate so that our families can still receive the great support that we hope to be providing, and that all of your organizations are certainly providing as well. But it shows sort of this discrepancy and this lacking of true infrastructure that we're left with when sort of this very integral part of our program is taken away. And so what we want to do is in a moment, Alicia is actually going to help us break out into some groups. We're going to do a real quick sort of small group conversation. And it'll only be for about 5 or 7 minutes. So no pressure. You also, I think participation looks different for everyone. And so do not feel like you have to communicate. Also do not feel like once you're in that group, you have to turn on your camera. I think the most important thing is that you feel safe in engaging in the way that you want to. And so if that means remaining quiet, or if that means remaining off camera, that is totally fine. But what I want folks to be able to discuss is just how have you communicated with families, right? During this time? How have you been communicating with your audiences? And how has that changed in the past 3 or 4 months versus, pre-COVID, right? Pre-March 13th, which will forever live in my mind as a day of infamy, right? And so, how are you communicating with your families? How has that changed? And if it hasn't changed, how do you potentially imagine it being able to change going forward as we look towards a future that is going to be in this sort of safer at home environment for at least a few more weeks, a few more months? I've got a few of you on video right now. If you can give me a thumbs up if that sounds like it makes sense to you. It's 10:39 right now, and so we'll come back around 10:45, and we'll do a real quick share back, and then Herbert will lead us in a discussion around sort of what this communication has looked for us and how we at Woodcraft Rangers have tried to address this problem. So again, what does your communication look like, and how has it changed, or how may it change? Just wants to state, as a facilitator, I both love and hate the timeframes of those breakout groups because it keeps me on time, which as a facilitator I'm terrible at, but I'm terrible at it because I just want conversations to keep going. And so I hope folks were in some good conversations, and appreciate your willingness to engage in that. And so I'd love, before sort of going into sort of the meat of what we do, I'd love to open up both the chat as well as a space for folks to sort of unmute and share just what did they talk about, right? What did they themselves hear from others, or themselves sort of what are you doing, and what does communication look like? And if it has changed, how has that changed for your organization? Either the chat, or feel free to unmute yourself and share it with the group.
Hi, good morning. I would like to share that in our group, we talked about using the Remind app to keep in touch with parents and to communicate and let them know about meals and the program overall, because a lot of us have a virtual summer camp, and some do have the social or physical distancing program as well. So it's nice to hear what are the methods being used to communicate with parents. And social media is a big one. So yeah, thank you for letting me share.
No, thank you for sharing, Maribel. Yeah, that's awesome. I think this is, our hope here is also just to be able to learn and see what we as a community are doing so that we can be more informed. What else? Anyone else like to share?
This is Uniqua from South Carolina State. I just want to share that with our group, We basically were facing the same issues with reaching out and just trying to stay in touch with families. And it's, I mean, it's not a good thing, but I'm glad to know that I'm not the only one trying to reach out, and it's kind of difficult considering how everything started March 13th, like you said. So hopefully during this summertime, I can reach out to more families and just get connected with maybe new partnerships or whatever, just so that I can have something in place for the fall with, just staying in contact. And I do thank you for doing the breakout session as well. Thanks.
No problem. Thanks so much for sharing. And yeah, I think, we've tried, I think what we know is that, these first few months, there's no wrong approaches, right? If anything, everything's sort of a pilot for what we're going to do as we get closer towards this next academic year. And so there's only learnings from all of this. And I want to thank Christy for her comment in the chat box as well, right, about sending weekly emails and activities, as well as doing weekly Zoom meetings. So I appreciate it. For sake of time, I'm gonna actually share my screen real quick to sort of open up what we see. Let's see if this gets going. And so we want to start with we want to start with this conversation around communication, because what we know right at this moment is that we're living in a digital time, right? We're living in a time where so much of our interaction and so much of our communication, right, is being delivered virtually, right? We're sharing information via Zoom meetings, right? We're sharing information via our website and social media, and those are all amazing. But as we get to this idea of how can we make sure that we're getting all of this information out to all of our parents as effectively as possible, or our constituents as effectively as possible, we do want to look at some research that we have found at Woodcraft Rangers, right? And so the study was done in 2019 by the Pew Research Center, and I think it was actually finalized. The results were posted in February of 2019. And so what this is around sort of internet access, right? We know that right now we're living in a technological time. And so we want to look at some of the data around the digital divide that we know exists, right? Specifically if we're working in Black and Brown communities, right? Or other marginalized communities. And so what this research found, right, was that according to the study, that 79% of white adults had at-home broadband internet, while compared to only 66% of Black adults and 61% of Hispanic adults. Right? This also sort of looked at the idea that in this growing age, there are more and more individuals, right, that are becoming smartphone-only internet users, meaning that they don't actually have access to at-home broadband and use their smartphone specifically, right? And so there was 17% of the respondents actually said that they're smartphone-only users. Additionally, right, of these respondents that were smartphone only, 25% were Hispanic, 23% were Black, right, and 12% were white. And so what we're realizing here, and what we want to look at, right, is that we know that internet access, right, and access to reliable at-home internet, as well as at-home internet ready devices, right, can itself be a challenge, right? And so while we are relying more and more on these resources, we want to identify and acknowledge that sometimes the existence of these resources, or how we are distributing some of this information, might be inaccessible to some of our communities, right, based on what some of this research has shown. The final point that we want to look at here, though, right, is that 81% of Americans own a smartphone. Right? And that number is, 80% of Black Americans own a smartphone, and 79% of Hispanic Americans, right, that responded to the survey own a smartphone, right? And so we know that internet access or at-home broadband access can be a challenge, but we're living in a time where maybe being able to provide some information via smartphone, right, might actually be a way that we can greater access to some of the information that we are looking at. Right? And so we want to base ourselves in some of this information, right? And this is sort of where I'm going to be kicking it off to Herbert to talk about how we at Woodcraft Rangers have sort of used this information to guide some of the decisions that we've been making in terms of how we're trying to get information out to our families. So I'll pass it to Herbert right now.
Yeah, thanks, Andres. So yeah, that infamous date happened, March 13th happened, and as soon as that happened, collectively, the staff at Woodcraft Rangers kind of said, there's got to be a way we can communicate easily to all of our parents. Being in Los Angeles, being across, a lot of schools across Los Angeles, we knew that we wanted to reach as many parents as possible to be able to communicate with them or be able to provide resources to them during this time that will help them get through this time. With schools being closed, with uncertainty of what's happening in the world today. So we decided to do kind of like a text-based support service for our parents, a way that we can kind of send out text messages to our parents and give them resources that revolve around many aspects, including health and wellness. And that's called Birch. So if you can hit the next slide, Andres. So Birch is our caregiver support service that we started we started implementing it in the middle of April. So what it is, it's resources that we provide to parents who have opted in, and then they receive it on their smartphone. Just as long as they're able to receive a text, they're able to receive those resources. We send a couple of messages throughout the day, 3 days out of the week, and it revolves around a couple of things that we're going to go into. But if you're interested in seeing like what is Birch, you can go ahead and text Birch Boost to 56512. So you can see the example of what I'm going to be showing next on the next couple of slides. You'll be able to see it from your smartphone. Let me just let everybody know standards rate apply to this because it is a text message. And also doing this, texting that code Birch Boost, it's not going to opt you in. You're just going to get one message that will kind of like welcome you and just kind of send you a link. And if you just tap on that link, you'll be able to see a mobile page that we've set up so you can see the examples of some of the stuff we've been sending out to our parents. So I'll give you all a couple of minutes to do that. And also I'll mention if you're not comfortable texting, if you kind of don't want to shift your attention away from the presentation, we will be showing you the examples of what you would see on your phone in the next couple of slides.
And we won't be using your numbers for anything or for any feedback.
Yeah. I've set it up in the back end so that it will literally after the presentation is done, whatever phone numbers we collected, it'll delete it from the list. So your information will not be used in any way. All right, so hopefully those who wanted to join in have had the opportunity. So I'll go ahead and show. If you tap on that link, you'll see something like this on your mobile phone. It's a mobile page. Somebody's asking in the chat, does it cost to use the service? The only cost is whatever your phone provider charges you. If you are not in like some type of unlimited plan and they kind of charge you per text, that's the only charge from Woodcraft Rangers. It is completely free other than that. We try to make it as free so that we're able to provide it to our parents who would need it at this time. So you can see it's a mobile page, so it's almost like a web page, but it's made for a mobile device. And you can see we send out a couple of messages throughout the day, 3 days out of the week. One of the first ones we send out in the morning is called the Bright Spot. It's just a very simple, easy, like low intro into like, hey, here's just a good, feel-good fact or feel-good thing about the world. So we've partnered with the Gasol Foundation. They've been able to provide us with a lot of stuff in the previous weeks. A lot of good content revolving around health and wellness. So you can see the Bright Spot there focuses on broccoli and the benefits of broccoli and what kind of vitamins it brings you. So maybe this is a very easy kind of message that the family can share and be like, hey, I didn't even know about these facts about broccoli. And maybe it kind of sparks up like, hey, you know what? We haven't had broccoli in a while. Maybe we can go ahead and make some broccoli for dinner or sometime throughout the week. And that's what the Bright Spot is. Then a couple of hours later, maybe like midday, they'll get an activity that's revolved around moving or getting some type of exercise. And we call this a body exercise. And again, the Gasol Foundation has been awesome these last couple of weeks in providing some of these healthy activities. So there's a link there to a YouTube video of an activity they provided in which the families can go ahead and start designing their own healthy meal just by drawing it out, making sure the portions are correct and the nutrients are there, and then actually drawing like what would be on their plate, right? So you can see that there's a way to see it on video, but then there's also a one-page PDF there. If you can see where it says download, you can download the PDF, or you don't have to. You can just kind of go ahead and kind of zoom in, and you'll be able to see the activity information there. A next activity throughout the day is some type of activity that revolves around either some type of art or mind. Kind of think about like a STEM or art activity, or even like Andres mentioned earlier, the commitment to service. So some type of activity that has to do with, you know, serving others or helping others, which I know is difficult right now during COVID. Like we don't want our students to kind of serve others, but hey, they're with their family, they're at home. You know, what better way to kind of get the kids involved with maybe like doing chores or doing something fun and interactive with their families that kind of show them like, this is how I help one another in my family. So here, the example right here that I put in is a nice little fun game called the dance chain game. And it's a way to kind of engage your mind, because you are kind of playing with memory, short-term memory, as you're trying to remember dance moves. But then it also, again, gets the body moving, and that's what these little reminders are there for. It's a way to kind of get families and be able to share this with their kids and be like, hey, you know what? I just got this text message at noon for Woodcraft Rangers. It's giving us kind of like a reminder, like, let's go outside and let's do some yoga with some poses that kind of resemble stuff that we have in, or that you would see in a garden or out in nature. Or maybe let's do some very basic stretches that we can even do inside the house or inside the apartment. All the activities, we really want them to be very easy to use, so that parents don't have to read through a lot. They don't have to kind of go out and buy anything. We try to make sure that any of the activities that we provide there are ones that have very little to no supplies needed to do these activities, or if they do need supplies, it's stuff that they have already available at their house. One of the things we were very conscious about is the safety of the youth that we're working with, and also the safety of their parents. So even when we tell them, hey, you know, you can go outside and do these cool little exercise or play this game that will get your body moving, we're still very conscious of saying, hey, make sure if you're going outside, make sure you're practicing your social distancing, make sure you go ahead and put on your mask, just to keep everyone safe. Towards the end of the day, there's the last text message and the last resource. It's called the Caregiver Connection. It's just a little useful tool that we provide to parents, a very easy activity that they can kind of do with their family. And it leads a little bit more to that social-emotional learning and wellness, right? A way that create bonding moments with the family, a way to kind of even talk about things that are causing anxiety or stress because of these uncertain times. And here in the example that we have here, it's a way to kind of let the family know it's good to kind of take a walk every now and then. You know, being cooped up around the house all the time is not good. You know, you need to go outside and get that vitamin D on your skin, make sure you're getting healthy. And also it's good to move around. It's also creating, again, those family bonding moments of being able to just walk outside maybe for 15, 20 minutes out there. And again, we mentioned, you know, practice social distancing, practice any way to keep yourself safe out there. You're seeing a modified version of this all in one page. We usually send it out messages throughout the day containing one of those aspects. And it's just a way to kind of remind families of like, hey, here's your bright spot, or hey, it's time to head outside and do some exercise, or hey, here's your cool little caregiver connection, a way to kind of bond with your family and kind of have discussions or have these wellness meetings with your family and with your loved ones. So this was kind of our way of being to provide resources to our parents and those that we work on in their community on a day-to-day basis. You know, the last thing too I forgot to mention is the comment section. So you can see at the very, very bottom of that page, there's a questions asked below. And this is another way we leave communication open to our parents. And it's been a resource where parents have reached out and asked for certain things. And then there's a way to kind of provide an email. So if it's a little bit more one-on-one basis, then we're able to email them directly. But if it's just a simple comment, you know, we're able to respond back just so that we're able to still have some type of communication with families. I know here in Los Angeles, it's a little tricky communicating with parents other than just maybe like email or social media. but yeah, that's how we've been able to show this solution to being able to communicate with parents. Jay, well, you want to go ahead and hit the home run and wrap us all up?
Yeah, I think, I know we're over time, and so just real quick, I want to thank everyone for this. I think we our hope here was not to, I think this is how we have approached it, and I think our hope in this conversation was just to sort of inspire or get us thinking in our organizations, thinking about how we can think creatively about the ways that we're also distributing the very important information that we have to our families to make sure that everyone has access to that information, right? That, it's just as important to make sure that that access exists. And so, again, we want to, thank Boost for the time, and we want to thank Daniel and Clarissa for such great information as well. So, thank you, everybody. We really appreciate it, and we look forward to continuing to work with all of you in the days and months to come.